In today's Health Watch, the number of preteen girls taking birth control is on the rise. That's according to a new study out of the UK. More than 1,000 girls ages 11 and 12 were prescribed some type of birth control pill last year, usually without their parents' knowledge. In Britain, doctors are allowed to prescribe it if they believe the child is mature enough to have sex. Now, the study did not show why it is being prescribed. The pill is often used to treat severe acne or heavy periods. Critics of prescribing the pill say that early it sexualizes those girls too young. Well, joining us today to talk about this, I know a lot of parents probably really shaking their heads at this, Dr. Huertas. He's a gynecologist with Forest Park Medical Center. Doctor, first of all, this is out of the UK. I think American parents, and especially those here in North Texas, are saying, please tell us, are you seeing girls as young as 11 requesting birth control in your practice?
Well, I don't necessarily, see them, requesting, birth control, but I do see them coming in with their parents, asking for having any other, medical problems like pelvic pain or painful periods or irregular periods, which at that point you can put them in birth control. But not necessarily they come in just, asking for or family planning or, birth control pills.
Yeah, I don't really know of any 10, 11-year-olds who would ask specifically to go to a gynecologist unless they were truly having some issues. So you're saying that the key reason to ask for birth control, heavy periods, as far as your experience?
Yes, typically you see, patients, especially, younger girls, when they start having their periods, they come in either with irregular periods or they start, having pelvic pain or even premenstrual syndrome. And then also, obviously, with problems with acne and hirsutism or excessive hair growth. So these are indications that we have to prescribe, birth control pills on the teenage patients. But necessarily for family planning, I don't think that's that common here, at least here in the United States.
Yeah. What are the side effects from taking the pill, especially this young?
Well, this young, usually the main side effects is usually breast tenderness initially. Sometimes you can have nausea, vomiting, which tends to be transient. It usually goes away after the first week. Also, some patients do have irregular bleeding for the first 3 months, which we usually tell the patients to, keep taking them, and usually regulates itself after about 3 months.
And real quickly, do you think younger women are more tempted to become sexually active if they're taking birth controls that young?
Well, I don't think it's a cause and effect issue. I don't think that just because, we're prescribing, birth control pills to young patients, that gives them a green light to have sex. To answer your question, I don't think it has anything to do. We need to understand that every year, for the last, 10 years, the age of early intercourse or, the first intercourse have been, coming down in the United States. Right now, the average age is about 14. And I think that's since the 1960s, it's just been, going, lower and lower. And I think it's quite because of the sexual revolution and also because of the media